Hi, I'm Laura, a patient navigator. I'm here today on behalf of your oncologist. During your consultation, your doctor had discussed about having nausea and vomiting as a side effect. In this video, I will talk about what causes nausea and vomiting in cancer patients and how to manage it. Nausea is feeling sick or the feeling you have when you are going to throw up, while vomiting is throwing up. Nausea and vomiting are very common side effects for chemotherapy, other cancer-related drugs, and also radiotherapy when given to the abdomen. Other causes in cancer patients are pain, anxiety, infections, constipation, food staying in your stomach for too long, fainting, and balance problems. Chemotherapy-induced nausea and vomiting is referred to by doctors as CINV. Chemotherapy-induced nausea and vomiting might be acute, occurring minutes to hours after treatment and usually stopping after 24 hours. Delayed, occurring after 24 hours of treatment, mostly with chemotherapy given for more than one day. Some patients experience nausea and vomiting before the next treatment cycle. This is called anticipatory nausea and vomiting. This is usually based on a bad experience of nausea and vomiting. Nausea and vomiting may cause several complications if not treated, including loss of fluids and minerals resulting in dehydration, loss of appetite leading to weight loss and fatigue, and injury to the esophagus, which is the tube that carries food and fluids to your stomach. Drugs, prophylaxis, and management. Although nausea and vomiting are common with chemotherapy and can be very annoying and impairing, they can be easily prevented by a number of very effective drugs called antiemetics. Your doctor will make a plan to prevent acute nausea and vomiting from happening by certain antiemetics that are usually injected into the veins before chemotherapy. The number and type of drugs given depends on the chemotherapy regimen and anti-cancer drugs you're receiving, whether they are highly or moderately associated with nausea and vomiting. The main classes of these drugs are Seratonin Antagonist as Undansetron, Neurokinin Antagonist as Aprepitant, Dexamethasone, Olanzapine, or other drug classes to manage nausea and vomiting are also available. Your doctor will also prescribe drugs to take by mouth to prevent delayed nausea and vomiting if expected to happen with the chemotherapy regimen you take, and drugs to take as needed. Please follow your doctor's instructions and take antiemetic medications in time to avoid risk of dehydration and other complications. How can you cope with nausea and vomiting? Do not avoid food. You will need your energy to get better. Instead, have small, frequent meals instead of 3 meals. Avoid irritating foods like spicy, fatty foods and foods with a strong smell. Hot meals tend to have stronger smells, so it's preferred to eat your food at room temperature. An empty stomach might cause you to feel nauseous. Try to have a light snack whenever you can. Adding sour flavors in your food such as lemon, ginger, pomegranate, and apple can improve nausea. Do not try your favorite food at this time of nausea, as you may develop a dislike to it. Drink a lot of fluids, at least 6 to 8 cups a day. Sipping small amounts of water during the day helps in preventing nausea and replacing the fluids you lost. Keep a diary of the number of times you experience vomiting each day to help following the symptom. And call your doctor in case you have other contributing problems such as pain or anxiety. When should you call your doctor or go to the emergency room? Persistent nausea and vomiting regardless of taking the medications. Associated diarrhea or fever. Fainting, dizziness on standing, dry mouth, and decreased amount of urine. This indicates dehydration that might need further treatment by intravenous fluids. Feel free to watch this video as many times as you would like. If you have any additional questions, be sure to reach out to your doctor's office or ask an oncologist in the OncoPower app.